Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Bekkum. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full-body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Hello, I am Dr. Victoria Lau. Here with me is Dr. Bekkum.
Hello.
And we are talking osteoarthritis today and some ways to manage the condition and the symptoms and how to improve your quality of life with some of the modalities we have at the office here.
Yeah.
Yeah. So let's talk. I know we have an email that typically goes out to patients giving some information, but we of course will talk about class 4 laser and shockwave, but maybe let's go into general osteoarthritis and discuss that.
Yeah. What is osteoarthritis? I mean, that's the question, that I hear patients saying, if we were to bring this up. And osteoarthritis is a wear and tear type of arthritis. I mean, yes, typically we're going to see in osteoarthritis, it can show up anywhere in the whole entire body. I mean, it's going to affect the bones and the joints. In the spine, it's also going to affect the discs in between the vertebrae there. And, as a person, creates more wear and tear. I mean, that's the best way to kind of describe it. Some people think, as I get older, it's just going to kind of wear out. Well, if you're not an active person, you're just sitting around, or you've done things in the past where you've injured things and your body's kind of protecting or guarding the area, that's where osteoarthritis is going to show up, because mostly the tissues that are in the joint itself, if we're looking at like a shoulder or a hip, we're talking about, like the joint capsule as well as the joint synovium, which is the cartilage that's on the ends of the bones there. Will start to get dehydrated if you don't keep them moving correctly. You get into the spine, and we're talking about the discs. And what happens with the discs, again, if your body's, its normal way of protecting itself is to shut down those joints or not have you use them. And the joints are going to start to lose that water content. So the discs, actually, when they're normal and healthy, would typically be about 80% water. And if you're not using the joint correctly, or your body's went into a kind of guarding or protective mode, you're going to start to lose that hydration of that disc. And that's what shows up as a disc starting to get thinned. And your body still wants to maintain that normal range of motion and all that sort of stuff to an area. So let's say we're talking about your neck. You're going to try and still maintain that normal range of motion, even though you have a disc or a joint that's maybe been injured by something, say a whiplash type case, and your body's just going to try and get that extra motion then out of the joints above and below it. So in the spine, it's kind of easy to see where that wear and tear starts to happen there. Generally, you're going to have to take x-rays of it to see that starting to show up. So you're going to see thinning of the disc spaces in the spine. If we're a shoulder, you're going to see a thinning, of that joint space. And after a while, if it's been there for a period of time, you're going to start to see the bony changes start to happen, where you start to get, bony spurs. Is that a good thing? Yes. I mean, that's the way your body's trying to protect itself. But do you really want to have that happen and restrict your range of motion and basically cause the other areas around it there to continue to break down? Because your body's going to want to maintain that normal range of motion. So we typically see the joints above and below the area get affected more, because now all of a sudden they're going to wear out because they're being used more.
So that, that sounds similar to when we see a patient that has a previous back surgery.
Correct.
And then, yes, say they fused an area to protect that area, but now we see the joints above and below beginning to be affected.
And typically, yes, it speeds up that effect of osteoarthritis on the spine because now, especially if you've had a fusion, and hopefully what they've done is they put in, like a bony block or some kind of cage in there to maintain the appropriate height that you normally did have there when you had a disc in there. That'll slow down the process, but because you don't have that space there where it normally would move because you had a disc there, now you're going to wear out the discs above and below that level because your body's going to, like I say, want to maintain that normal range of motion there. So,
well, makes sense. The body has to stay moving, right? It's when you're not moving is what we call 6 feet under.
Correct.
We don't want to see that.
What happens when you stop moving? You're dead.
Yes.
And it sounds kind of funny, but that's the absolute truth. I mean, that's what happens when people, after they retire. I mean, if they've been an active person all their life and all of a sudden they decided that they're going to retire and they're going to sit at home and drink beers or coffee and watch TV all day long, I can't remember the exact number, but a significant amount of them are actually dead within a year because they're so used to, maybe being on their feet and moving or being active, period, and go to a sedentary thing. I mean, that's why they even say sitting is the new smoking, because as soon as you sit down, you restrict blood flow. You don't have that, getting through the rest of your body here. And, yeah, maybe you feel achy and sore because you were active and moving before. Yeah, maybe you did have some osteoarthritic joints, and by keeping that motion there, it at least kept them functioning, maybe not at 100%, but it kept them functioning in ways that would at least keep them somewhat healthy. But as soon as you sit down, you don't get that blood flow there, you don't get that motion or movement there. It just causes everything to seize up. So
stay moving, stay healthy. If you got to retire or going to retire or want to retire, still stay moving. Find something fun to do.
Find something fun to do. Find a hobby that you like to do. I mean, I think that's the big thing you need to really start planning for. I mean, I think anytime there's a transition in life, a person really needs to start looking at, okay, I'm going to go from working all the time here. What am I going to do now that I'm going to retire? I'm not just going to sit my butt down in a chair and do nothing. You need to keep yourself active. Maybe you just want to golf all the time, get a membership at a golf course, move down south, go to Florida, go to Texas, go to Mexico, move wherever you want to, but make sure you have some kind of activity that you like to do. Maybe you like photography, go for hikes, take some pictures of different things. Maybe you like to bike, find a community where you can be active. Pickleball is picking up, and there's more and more people that are retired, and they're doing things like pickleball. So, hey, it's fun. You have some community and social things that you can do by just maintaining active motion and movement, and that's what's going to keep you healthy. Yes, you might get some achy and sore joints, and that's what we'll kind of talk about here, some of the different things that we have that can be helpful that are non-pharmaceutical, non-invasive type things that can help you deal with osteoarthritis, but you need to keep those joints moving, or otherwise they're just going to get worse. So,
and some of these options that we have here, have little to no side effects, so why not?
Yeah, there's really no known side effects to really all the therapies that we have in our office here. So, I guess, why don't we just kind of get into some of it? Like, our class 4 K laser, we have the latest and kind of greatest one that they've put out right now. It's a 100-watt laser. Might not mean much to you, but most of the typical lasers that are out there, some of the original ones that came out, were 150 milliwatts or 100 milliwatts. We have a 100-watt laser. It's what? 1,000 times. I don't do physics. 1,000 times stronger than some of the lasers, that you're going to pick up. I mean, even the ones that people can buy in stores, it's not even going to compare to, what we have in the office here. The other big thing is, even with other offices that have lasers, their peak, they might say that, they have a 40-watt laser. Well, it peaks out at 40 watts, but most of the time it's running at 1 watt, So it's a little bit deceptive there. So even at that, ours is still 100 times stronger than what they have. Ours will pulse at different things, and it'll go down in wattage as well, but What we want to get out of there is the joules. How many joules of energy are we putting into your body to help it heal up? And what does class 4 laser help with? Pain, inflammation. It helps increase blood flow. It helps regrow the nerves. It helps stimulate the mitochondria of your cells, so down to a cellular level. Your mitochondria cells are the powerhouse of your cells. They're producing the energy for your body to heal itself up. So it's kind of like a cellular exercise because it's getting those mitochondria to, when mitochondria are at a rest state, they produce 2 ATP. That's the actual energy that your body uses to function. When we stimulate it with a laser, it produces 32 or 16 times the amount of energy as what it would in a resting state. So combine that with the power that we have, we can do it in a very short period of time. So a lot of these, an example would be like our patients that have neuropathy. Originally when we'd run a full neuropathy protocol on people, they might have to be in for an hour. That got cut down to 12 minutes. So let's talk about osteoarthritis. I mean, even in the past, we had a 20-watt laser from K-Laser. That was kind of their latest and greatest, maybe 6 years ago when I bought it, 7 years ago. And, that would take probably, on the low end, 6 to 8 minutes. On the high end, it might take 20 minutes to literally get an osteoarthritic knee treated. Now it's down to 2 minutes. So you can come in, you can get the treatment done, you can be in and out of here and feeling better in a very short period of time.
And that's impressive. Again, with those no side effects and increasing that chance for your body to heal itself, regenerate itself.
And actually, another thing that we just got in the office here, in fact, they're even hooking up here today in the office, is in addition to some of our other testing equipment, they came out with a thermography unit here, so we can even now be able to see where you have inflammation going on in your body, where you have decreased blood flow. And we can even then measure and see how well is the therapy working on you here. So these things that are kind of unseen by the naked eye, by most people, I might be able to go in there and feel and see where I feel the inflammation going on, where I might feel some of the scar tissue that's maybe there from, just having an osteoarthritic joint and how the tissues are just being affected. But now we're going to have that ability to see that and how it's improving as you go through treatment. So,
yeah, that's pretty radical. I'm excited to see this thermography up and running here shortly.
Well, I think it's going to be cool for a short period of time. I mean, we'll probably reach out to our existing patients here so they can be the first ones to come in. If they have something that they want us to take a look at it and use the thermography with, they can come in, we can take a look at it. I know our neuropathy patients, that's a huge thing because they have decreased blood flow, typically in their feet, but also in their hands. And we can get that measured now and be able to, see that on top of all the other testing that we have, including some neurodiagnostic testing that you're only going to get in a hospital setting other than, what we have in the office here. So,
well, that will be exciting for all patients, new and existing. So on top of the laser and now the thermography, shockwave has always been, part of a treatment protocol, but that too with osteoarthritis seems to be moving mountains, huh?
Yeah, pretty significantly here. And I guess let me even just speak to, we have two different forms of shockwave therapy in the office here. If some people are familiar with what's called A-stim, some people, there's different techniques out there. Like one is called Graston. Some people might be familiar with that. That's using like a metal instrument where we can help break up scar tissue, myofascial adhesions and fascial restrictions and stuff like that. The manual instruments that you would use, they maybe will help penetrate or break up stuff that maybe goes a half an inch to 3/4 of an inch deep, which is great. And I would tell people we'd probably be able to get 80 to 90% of their condition resolved and scar tissue broke up with that. And like a year and a half ago now, a little bit more than a year and a half ago, we got in the two different forms of shockwave therapy, The next one is what's called radial pressure wave. It's literally, some people call it a jackhammer. It's pretty, I would say fairly comfortable. I mean, it's just like any of the soft tissue treatments. There's a little bit of edge to it. Nothing that's unbearable. I mean, typically it's definitely below our 4 or 5, out of 10 on the pain scale. So it's a little uncomfortable maybe when we run it. But as soon as we get done, people are like, oh my goodness, they probably have, greater than 50% pain reduction in using that. But what I'm seeing with that radial pressure wave, shock wave therapy, that now penetrates, up to about 1.25 inches deep. So about a 1/2 inch further in depth than just using a manual instrument. And that can make a huge difference in people, especially if we're working along the spine or something like that, where people have, not necessarily that deep osteoarthritis with the vertebra. We're not going to get down to that, but more with the facet joints, more with some myofascial adhesions that are happening in the muscles along the spine there, that osteoarthritis can start to affect some of the facet joints on the vertebra there. So if we get all of that a little more pliable, so you can get better motion or movement with those joints, it makes a huge, huge difference. And then the third kind of form of soft tissue treatment here, that works awesome for osteoarthritis, and I always say we get shocking results. I mean, I can't come up with a better pun than that, but if you look at like osteoarthritic knees, literally, most people are getting even on their initial treatment, definitely greater than 50%, but a lot of people are getting 80 to 90% pain reduction with that therapy on that first visit. Typically lasts a couple of days. Depending on the severity of the condition, we'll let you know what we think is what is probably going to take to go through a full treatment regimen with it there. But again, it's helping to the shockwave, this focus shockwave. And let me describe this a little bit better for you. It's an electrohydraulic shockwave, and it's focused. So what I always describe, it's like if you look at like a pen, it's going to penetrate up to 5 inches deep in about, the thickness and the width of a pen. There's also an unfocused portion to it, so you're going to get a little bit of overflow in and around the area there. But I like the idea that we have a focused one, because we can get in there and all of a sudden we'll hit areas that people have. They might have a myofascial trigger point, but like on an osteoarthritic joint, we can hit those spots that are bothering. All of a sudden you're going to go, oh yeah, that's where I'm feeling the pain. So you know that we're getting into that tissue and getting that tissue treated, that it's going to help resolve your condition for you here. Because what this focus shockwave does, it's electrohydraulic. It actually is helping to reduce the pain, reduce the inflammation, and it's also helping to regrow the cartilage cells. It's actually helping to stimulate your body's own stem cells to regrow that cartilage tissue in there. And usually we're going to have people taking some supplements on top of it, things like NAC or N-acetylcysteine. That'll help your body get a little bit more water content into the collagen fibers, especially in the joints there. But also then long term have them taking a glucosamine with MSM supplement, just to help make sure they maintain the hydration in the tissues there long term. But the shockwave, I mean, it's most people that come in and get it done, they just can't believe how much better things feel literally on that first treatment. So we will have some specials going out probably shortly here, so if people want to come in and test it out, they can come in and get a sample of it here just to see how much it can help you. I mean, it's once you have it done once, you're going to know that, okay, yes, again, it's non-pharmaceutical, it's non-invasive, and you're going to get shocking results with it.
Any contraindications to using shockwave?
Shockwave, the only thing with shockwave there is that we have to avoid, people that have things like pacemakers, heart defibrillators, like even like the Inspire. I mean, if any implanted electronic device, some people have some implanted TENS units for, spinal pain. We can't be running it on them, but we could be using that radial pressure wave. So maybe that's all we can do, but we still might be able to get a good portion of things cleared up for you just using that radial pressure wave too. So,
and that with the implanted devices, you can't use it entirely on the body, or just not in that area?
Entirely on the body. Yeah, because we're putting it with a focus shock wave, and it's just the focus shock wave. You're putting in an electric stimulus with that therapy. So just to be overly precautious, we can't run on anybody with any implanted electronic device. Laser, we can run that on anything. I've even had a patient, they had me talk with the scientists at Medtronic there, and we just need to keep the power unit of the laser away from the person's pacemaker there. We can run the laser on them. We can use laser on pregnant women as well. I mean, but pregnancy typically is, for most therapies, is, everything's kind of out. We just don't want to be running the laser anywhere near, the uterus or the abdomen or anything like that. So if you have an ankle sprain, knee issue, shoulder, hip, neck, head, obviously we're not going to be shining that laser anywhere near the abdomen there. So.
Wow, that's a lot going on. Now, besides, we've talked about where we may see people respond like 50, 80, 90% feeling better. Is that in total, like per treatment? Is that how are you measuring that? Like long term? What do we see
per
now?
treatment? And then like laser. I mean, again, anybody with any of the therapies here, like if we look at the class 4K laser, typically once we get done with people with treatment there, again, we'll outline exactly what we think you need, and we'll let you know how long a time span that your treatment's going to take, probably how many visits we maybe need to do in that period of time. So we can give you a pretty accurate number as far as what the cost is going to be on it and all that. So you'll have, you can make an informed decision before you decide to follow through with treatment, because I don't want to have people starting treatment and then not following through, because then you're not going to get the results you're looking for. We've had a few patients decide that, hey, that I just don't want to follow through. Even though they're getting better, we have tests that show everything's getting better and all that sort of stuff. They just, for whatever reason, don't want to drive here, don't want to follow through, whatever happens to be here. But so basically, if you can kind of follow through with everything here, if you follow through, laser, once we kind of get you there, you might need some typical kind of follow-up type treatments there. So say it's super chronic, severe, obviously we're not going to probably get it back to normal or something like that, but we might get it to a point where, hey, it's actually feeling pretty good here. You might need touch-ups once a month, twice a month, maybe once every 3 months. Everybody's different, and that's why we'll take a person through a treatment plan and try and give them a pretty good idea of what they maybe need to do long-term there. But typically, if it's spaced out that far apart, I mean, laser treatments are pretty reasonable for most people to have done on an individual type basis. The focus shockwave, a lot of times, those mild, moderate cases, usually once we're done, it really shouldn't probably come back. Obviously, if you stress it again or something like that, you're in a sport and you come in and you had a sports injury or something like that, and you had it re-aggravated, well, obviously we need to probably take you through another treatment plan again. But osteoarthritic type joints, you walked up and down too many stairs, you were at a wedding or something like that, and you had to climb some stairs because the elevator was broken or something, and those knees are starting to feel a little bit there. Obviously, you might come in for a short burst of treatment again, but typically, usually I'm kind of combining the two therapies together because that gives us the best result overall. The laser with the shockwave, the focus shockwave therapy especially, and a lot of times people are just going to need some periodic touch-ups. I would say, once a month is probably typical. Could be as frequent as every other week. Could be 3 months before you need another touch-up on it. So,
And that's all determined through, of course, setting up an initial treatment plan, getting you out of this acute, let's start improving, out of this
go
chronic.
from pain relief, go through a rehabilitative type program where we're going to include some of these therapies with, but also some exercises to make sure you can move those joints properly through a proper range of motion and start to strengthen them up so you get, at least 85% function. I mean, that's usually about when insurance companies say, hey, you're average now, so you're going to be done here. And if you do need maintenance, I mean, that's always on the patient's responsibility there to kind of follow up with. So you get to choose if you want to follow through with that. So we'll be communicating all the way through the whole treatment there. So you're always in control of your own therapy here, and you get to choose how long you want to go through. And if you kind of want to follow up with stuff to just make sure things stay well, because, we're here to help you function at your full potential here. And if that's where you want to be at, we'll support you along the way. So,
and I think that's a good thing to, reiterate that a patient comes to us looking for care. You may not need to know exactly what things are doing for you, but we give you the treatment. This is how long it's going to take. This is what we're going to see along the lines. And then you make an informed decision for yourself. Yep. Do I want to go through full care? Do I want to try some care? Do I want to maintain and do an adjustment here and there? But, we're here for you, but ultimately your health is your decision.
It's the only way to go.
Mm-hmm.
I think the nice part about, what we have is that, it's shouldn't be like it's addictive or anything like that, where you have to come in because you have to have the therapy. It's like, oh, I feel like I tweaked it a little bit here. And with that, you can come in, and a lot of times it just takes a visit or two, maybe 3, 4, to get you back on track again there. And then you're just kind of on your way again. So
beautiful. Well, so if you have osteoarthritis or know somebody that does, certainly send them our way to All Seasons Integrative Health, and we can, just set up a chat and discuss, what's going on, and do an exam and give you the rundown of what it might take to get you better and what that might look like for you.
Mm-hmm. We always have free consultations, so you can always come in, and we can always kind of sit down, talk about what you have going on, let you know what you need to do to kind of move forward, to give you a clear picture of what it might take to get treated, what you need to get treated. But like you say, like we just talked about, then you can make an informed decision whether you want to move forward or not. So,
health, important. Once you lose it, it's hard to get back. I'll speak from experience. So, all right. Well, Dr. Bekkum, any last words?
Well, if you have any questions, just reach out to us. We're always here to help you, and set up that free consultation if you do want to kind of come in and find out what it might take to help resolve what you have going on. But otherwise, I hope that was informative for you, and have a great day, and we'll see you next week.
Awesome. And make sure to follow us on your favorite streaming avenue, and we are the Extraordinary Health Podcast.
Have a good day.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.